Hello, I'm Clara. I'm a holistic nutritionist, and I'm here today with Dr. Edouard Sayad.
Hi, I'm Dr. Edouard Sayad, pediatric pulmonologist.
We're going to talk about toxins today, and we're going to talk about the harmful effects of toxins on children and babies. So, parents today, they put a lot of efforts to get the best for their children, the best schools, the best food, but sometimes they tend to forget that skincare is also very important. So, doctor, can you tell us about the harmful effects of the toxins in the body for children
All right, so
and
you
babies?
mentioned skincare, shampoos, sunscreen, and all of that. So all these products actually have a lot of different substances. Some of them are good substances for the body, and some of them are toxins or preservatives. So it's impossible. It's very difficult to control every single substance or every single toxin that you find in commercially available product. But it's important for people, for clients, for patients, for parents to be mindful of what is available in these products. So first, it's important to read the labels and to understand most of the products that are there. So as you mentioned, some of these are toxins. What are toxins? They're substances that can be harmful on the short or on the long run on the body, and that can be absorbed by the skin in small or big quantities. Why is it important for kids? Mainly because kids have a big skin surface to their body weight in comparison to their body weight. So they tend to absorb a little bit more than adults. And there are many things, many toxins that we can discuss. I don't know if you want to mention a few or you want me to mention a few.
Hey, can you give us a couple of examples of the really bad toxins that we shouldn't buy when we buy a product?
All right. So there are different types of toxins. First, you have some of them that have a mild effect, like fragrances or dyes. These might not cause, a lot of absorption or long-term
The
effect.
baby can get rid
But
of them, the body.
the body can get rid of them. It doesn't accumulate in the body, but it can cause irritation. It can cause local irritation. It can cause allergies. And for babies with atopic skins like eczema or baby with allergies or asthma, they can cause respiratory symptoms sometimes as well. Other than that, you have things like mineral oils or nanoparticles. These are very small particles that can go in the skin and then accumulate with long-term effect. Because we're talking about shampoos, we're talking about soaps, things that the body will be exposed for years. So the cumulative dose sometimes can be high enough to accumulate in some of the organs and can cause some dysregulation in the bodies. Other toxins that we can see are sulfates that can also can cause irritation, parabens and
Phthalates.
phthalates. These can be absorbed, and these also can sometimes affect. We don't have enough studies on that. The FDA has not banned them completely, but there are some evidence that they can cause some endocrine and metabolic disruptions. So it's important to be mindful of these substances, and if they're available in big quantities in the soaps or baby products we're using, better switch to something more fragrance-free, natural, or more organic. We will never find 100% clean product, but as close as we can get to something natural, I think it would be very important. These particles, some of these particles also, especially if there are micro or nano element or some metals sometimes, there has been studies that long-term effect can also cause cancers, endocrine issues. So it's important to remember
There are
that.
some studies that show that they can also lead to obesity.
Depending on the substances, some substances can accumulate in fat and can accumulate in the liver and can, on the long run, affect the metabolism.
Okay. So I think that it's very important to be mindful and to be aware. Just like when we're in a supermarket, we turn the product and we read the labels. It's important when we get some skincare to turn the bottle and not only rely on what we see in the front of the bottle and read ingredient by ingredient. And of course, the shorter the list is, the better. And some, like Dr. Edouard said, we cannot be perfect, and we will never find a product that is 100% perfect. And we don't want to go there. We just want to be balanced and mindful. Do you want to add something?
No, I think this is the main message, to understand the product we're buying. If we're not sure about a label we're reading, you can just look it up or ask your medical provider. And I think that's it. Limiting the toxins that we're exposed to I think on the long run will help our children be healthier and less exposed
Make the right
to this.
choices.
Exactly.
Okay. So if there's a rash on our baby, how can we know that it's related to the product or to the sunscreen? How can we know this?
So rashes and irritations are very, very common in babies. And sometimes it's nothing concerning, and sometimes it could be uh, causing or be caused by an underlying disease. Anytime you have a rash that you're not sure about, it's very important to consult with your pediatrician or doctor, whether in clinic or via an online consult on DRAP. And this will help you better understand and investigate where it's coming from. So some of these substances, as we mentioned, can be very irritative and allergic and cause these rashes. So it's important to discuss this with your doctor. And anytime you have a new rash that is, weird looking or a little bit different, doctor will ask you if you change a soap, you change a detergent, something has changed, because some of these things can cause allergies and contact dermatitis, etc.
So can you tell us from a medical point of view the importance of healthy nutrition for a child's growth and development?
All right, so I think you pinpointed a very important topic that not a lot of people are aware about. So food and nutrition is central to a child's growth and a child development. And the food we eat and the nutrients we take actually affect our growth and our health, short and long term. So it's very important to have a well-balanced diet very early on, as early as
6 months.
4 to 6 months, whenever your pediatrician decide that it's appropriate for you to start solid food for your kid. It's very important to start a very well-balanced diet, rich in vegetables, in fruits, introduction of protein, and include fats, good fats, and microelements very early on. Kids have been exposed to a lot of sugar historically. We've seen a lot of kids eating sugar early on, eating food with conservatives very early on. We've seen a very high, an uprise of fast foods and unhealthy food in school, in nurseries, in daycare, all over the world. And this has contributed to increasing the prevalence of obesity in children. If you look at the last, 30, 40 years, you see that in some countries, child obesity is reaching around 30, 40% some places. And this is very, very bad on the long run. So high sugar intake, especially sugar in babies, can give you early metabolic syndrome, which is obesity, cholesterol, cardiovascular diseases, and fatty liver. And we've seen that, recently, a study in the States has shown that for the first time in the last 5 years, the life expectancy of children is lower than their parents. And this is mainly due to all these chronic diseases that have been arising a little bit earlier.
And I believe that this is also due to the lifestyle. It's not only about the food, it's also about the fact that children don't move anymore with their screens. They eat with their screens. They have iPads at the age of 2, 3. There is no mindful eating anymore. So it's very important for parents to set the good example and to teach their babies that this is very important for immunity, for gut health, and for all the rest. It's very important to be able to sit and to eat without screens. And it's very important to move. It's very important to raise awareness on sports. It's also related to...
Of course. We're seeing more sedentary lifestyle.
Exactly.
So it's important that, as you said, to incorporate mindful eating, that kids nowadays understand what they're eating and enjoy the moment. As you mentioned, mindful eating is very important. Nowadays, kids have a more sedentary lifestyle. They spend a lot of time, sitting on screen. Screen times is a big thing. We try to limit screen time in babies, especially before age 2. We try to limit screen time to almost none, especially during eating. Mealtime should be a time they enjoy with their parents, a time where kids are enjoying food, to have a good experience, a positive experience with food. All these actually experiences can affect the child's growth and their later, if you want, or future relationship with food. We've seen kids sometimes having some, decreased appetite or being picky eaters. So it's very important, as you mentioned, to introduce a lot of different variety of different food, different colors, different textures early on.
Even before the age of 1, it's the baby can eat everything. There are very few things that the baby cannot eat at 6 months. So it's very important before the age of 1 to expose the babies to everything. Everything that we eat, they can eat. Mealtime should be a happy time where the baby learns how to sit and to give importance to this moment.
As you mentioned, mindful eating is very important. Nowadays, kids have a more sedentary lifestyle. They spend a lot of time, sitting on screen. Screen times is a big thing. We try to limit screen time in babies, especially before age 2. We try to limit screen time to almost none, especially during eating. Mealtime should be a time they enjoy with their parents, a time where kids are enjoying food, to have a good experience, a positive experience with food. All these actually experiences can affect the child's growth and their later, if you want, or future relationship with food. We've seen kids sometimes having some, decreased appetite or being picky eaters. So it's very important, as you mentioned, to introduce a lot of different variety of different food, different colors, different textures early on.
Even before the age of 1, the baby can eat everything. There are very few things that the baby cannot eat at 6 months. So it's very important before the age of 1 to expose the babies to everything. Everything that we eat, they can eat. Mealtime should be a happy time where the baby learns how to sit and to give importance to this moment. Let me see what else. Nutritional deficiencies. Do you want to talk about this?
Tu peux parler de nutritional deficiencies. Tu peux parler de nutritional deficiencies.
Kamine, on peut dire que if the
بالnutritional deficiencies أو بالإكساس تبع هذا إنه we mentioned the rise تبع diabetes عند الولاد.
هلا
we talked about
I
this,
talked about
no?
it briefly. Saline, إذا بدك on peut parler. Je peux read well on it.
Je pense, je te dis. Ok.
Dis-moi si tu veux, what are some medical.
Non, mais pour que les idées s'affilent, non. Toi, tu peux dire, oui, if the parents do not expose their children to everything, it can lead to some nutrient deficiencies, des carences.
Écoute, dans la bouffe, il y a 3 trucs. Tu veux les mettre comme ça. Tu as excess sugar ou unhealthy food. That will lead to metabolic syndrome, اللي هي obesity, diabetes, hypertension, etc. Ça, c'est un truc. Tu as the lack of color, textures, and mindful eating, which can cause a negative relationship with food and being picky eaters long time. Et tu as le troisième truc qui est aussi important, c'est les artificial dyes et tout ce qui est des trucs comme ça, that can affect neurodevelopment, autism et tout ça. Donc ça, c'est, je pense, les 3 trucs qu'on peut dwell on.
Also, parents should encourage their children to have healthy snacks at home. And by healthy snacks, I mean homemade snacks without preservatives, without artificial dyes, not filled with sugar.
So you're right. It's very important for kids to learn as they grow and to mature into making the right choices. And the kid will not make the right choice if he's not taught how to make the right choice. If, let's say, you take your 3 or 4-year-old to a restaurant and you show him the kids menu, where all the options are either high fat, high sugar, or
chicken nuggets, fries,
exactly,
pasta,
fried food.
So
the choices are very limited. So it's important early on to let kids enjoy healthy options. And it's important for society also to start giving these healthy options.
At the age of 1, even less than 1, a kid can easily enjoy a salad filled with protein, fiber, good fat.
Very important. And also there's a big responsibility for schools and daycare to offer these things. Some places started in Western countries to remove vending machines from schools for years. The choices were chocolate, were chips, potato chips, soda and pops and juices high in sugar. And this definitely contributed to the uprise of diabetes, type 2 diabetes, metabolic syndrome, which is obesity, fatty liver, cardiovascular diseases on the long run. So it's important to protect our kids early on. Another thing that you mentioned, I think, was the dyes and artificial dyes that we find in some foods. So it's important to read the labels. And when we see such things, to try to limit these foods because it's toxin. These are toxins. These are poison that are going into our kids' body. And there has been, studies showing that these can, on the long run, be risk factors for some neurodevelopmental and issues and autism and all of that. So we want to try to, as much, promote, healthy nutrition, mindful eating, give our kids as much nutrients as possible, limit toxins and additives, so they can grow and thrive into healthy young adults.
Of course, and without forgetting that hydration is super important as well. Children should be taught to drink the right amounts of water, and we should teach them how to get the habit, how to learn how to drink, and the importance of hydration.
Exactly, I agree.
Thank you so much.
Thank you.